Hello my people, so let's take a few minutes to learn about this pregnancy test strip and how to use it, and also how to read the reports, things that you need to know. So first of all, this is the pregnancy test strip, urine pregnancy test strip. So the sample required here is urine. Some of the strip, you can use the blood serum and then the urine. But let's talk about the urine for now, because that is what you can test yourself anywhere you are once you get the strip. So when you buy the strip, the first thing that you need to know is read about the dates. Check the expiry date to make sure that this strip is not expired. So it's very important that you read the expiry date. So looking at this one, you can see it was manufactured around 2024. April 30th, and then the expiry date is 2028 April 29th. So it's very important that you check the expiry date. Then let's read the inscription on it. For in vitro diagnostic use only. So in vitro is outside the body, you understand? So the urine, the test is done outside the body, and the in vivo is inside. So let's read what is written in red. Immerse the test strip into the sample. Take strip out after 5 seconds and lay the strip flat. Read the results within 5 minutes and then store at room temperature, 4 degrees Celsius to 30 degrees Celsius. So this is the pack, you understand? So when you tear the pack, this is the strip. It is inside this rubber pack, you understand? So this is the strip, and it's saying that immerse this strip into the sample. So the sample here is the urine. Your urine is the sample. So from the drawing here, you can see the container there. So this container contains the urine. The urine is inside this container. Then you immerse the strip, this one, into the urine. So you see the tip here. From this white end to where the blue line is, you can see an arrow pointing down there with marks written there. So you immerse that end into the urine where the arrow is directing into the urine. You make sure you don't immerse it above the blue line. That means above the blue line shouldn't enter the urine. It should be up to here. That's why you see the maximum. So it shouldn't pass the blue line. So you hold this side, you immerse it into the urine. Don't let it pass the blue line here for about 5 seconds. So you see the urine, traveling up here when you insert it. So for about 5 seconds, then you remove it from the urine and you lay it flat down, like I've done. You lay it flat down like this. And you wait for 5 minutes to read your results. So I'm sure you all understand the procedure. Now let's come to the results. And these are the inscriptions. So when you insert it within 5 minutes, the urine will move from this part up to this part. So the result is read at this place where the white space is in between this blue end and then this end. In between here, that's where the result is read. So let's look at this one. It says negative. So this white end here is here. The white end here where the negative is written is here. So it's traveling from this place to that place. In this case, it's traveling from here upwards. So if your test is negative, or you are not pregnant, or the ACG is not in your urine, then you will see only one line closer to the blue end where you held. The line closer to that end is control line, and that line has to be present. But when you see that line, it doesn't mean you are pregnant. So that report is negative, and then it's negative, and then positive. Positive means you see one line closer to where you held, and then another line closer to where you immersed into the urine. So you see 2 lines, one line here and the other line here. And that is it on this drawing. You see one line up there and then another line up there, down there. And that is positive. Now let's come to invalid. invalid is when you did the test and there is no line on the test strip. Even though the urine has traveled from this place to that place, but you didn't see any line. So when you don't see any line, it doesn't mean it's negative. It means it's invalid. See, there always has to be a line. There always has to be a line. So if the line is above where, closer to where you held, then it's negative. But if you see two lines on it, then it's positive. If there is no line on it, then it is invalid. So if you have any question, drop it in the comment section. Don't forget to follow, like, and share. Richard Koku here. I'm out.